Thank you, Chairman and members of the Senate Health and Human Services Committee. For the record, my name is Christina Warriner. I serve as the New Hampshire State Director for Reproductive Equity now. And today it's my honor to uplift the voice of Sarah Terrell, a mom from Plymouth who could not be here today, but could not sit on the opportunity to share her and her daughter's story with you. I'll read her testimony to you now. Thank you for the opportunity to share my testimony. My name is Sarah Terrell, and I live in Plymouth, New Hampshire, and I strongly oppose HB 377. I'm not only speaking to you as a concerned citizen, but as a mother who loves her child more than anything in this world, a mother who, like every parent, wants nothing more than for her child to be safe, healthy, and happy, and yet here I am once again pleading for the right to provide my daughter with the life-saving medical care she needs. When my daughter was in elementary school, she began to experience intense anxiety. Her worry brain, as her first therapist called it, convinced her that everyone around her was judging her, watching her. If you've ever had a child struggle with mental health, you know the feeling of helplessness watching them suffer, knowing that recovery takes time, patient support, and sometimes medical intervention. Her anxiety worsened, and eventually she was also diagnosed with depression. We spent years worried and searching for answers. Then she came out as transgender. Our first call was to her primary care provider, who referred us to a gender clinic. Her transition was slow, cautious, and deliberate. It began with a social transition carefully coordinated with her school and coaches. We found an experienced therapist to support her mental health, and we spent months in conversations with her medical team, discussing every option, every risk, every potential outcome. Only after more than a year of thoughtful planning, research, and guidance from experts did we begin puberty blockers. And slowly my daughter began to get better. Her mental health improved, she started to thrive. A full year after beginning puberty blockers, we again entered a deliberate phase of consultation and preparation with her medical team, this time to consider hormone replacement therapy. By the time her therapist wrote a letter recommending this treatment as medically necessary for her gender dysphoria, the same therapist also noted that my daughter no longer exhibited signs of depression. In the span of just 3 years, my child went from being severely anxious and depressed with suicidal ideation and multiple rounds of safety planning to being a joyful, confident teenager. I'm happy to stop if you'd like me to, and I have her.
If you have that written out, feel free to give it to our staff, and we'll make sure everyone gets a copy of that.
And her email is included, and she said she'd be happy to take questions from many of you.
Any questions? No, I know you were reading testimony, but thank you.
Thanks.
Lee Brown.